Dr. Jason Hans at Neck and Back Pain Relief Chiropractic here in Smoky Point, Washington. I want to thank you for joining me today. Today I want to talk to you about whiplash injuries, what they are, what they feel like, what to do about them, and importantly, how long does it take to really recover from them. So first, what is a whiplash? A whiplash is an injury to the cervical region of the spine when a great force causes the neck to go beyond its normal range of motion. And let's take a look at this. With either a car accident or maybe a work injury or some kind of recreational activity that makes kind of a whipping mechanism take place in your neck, you can find that it leads to injury, pain, and inflammation. Specifically with a whiplash injury, you can have headaches and migraines. You can also have pain that goes down the arms, numbness, tingling, perhaps some weakness. If it's a car accident, I see concussions and some other issues with that. Very important to get checked out and not just let this type of injury go, because a lot of times the injury does not go away. It seems to crop back up for people and become kind of an annoying menace over time, depending on how significant the injury really is. So to answer really the question, how long does it take to recover, it depends on how active you are. It depends on what type of health your body is in before you get into an accident. It's really important to remember that too much rest and inactivity leads to long-term disability. Of course, this must be balanced with degree of injury, but even when the injury requires some downtime, stay as active as possible during the healing phase, because that will accelerate the healing process and get you back to where you were before the accident. So many people will recover within a few weeks, and some will take months to really recover, and some who don't rehabilitate and treat this properly through chiropractic and rehabilitative exercises and so forth, this can be a chronic condition that stays with them for a very long time. So during recovery, you can expect your condition to fluctuate in terms of pain. It's very important to listen to your body and let it be the guide during your activity, during exercise, and it's very important to stay within a reasonable boundary of pain during your activity. Remember, your best chance for a full recovery favors continuing a normal lifestyle. Make reasonable modifications so you can work, socialize, and do your normal activities. But there's an adage, move it or lose it. Very important to stay moving. In fact, the key is really to stay in control of the condition and do not let the condition control you. Here are some tips. I want to give you 6 tips to be able to practice at home and to be thinking about with this type of an injury. So first is, really get checked out, make sure we understand what the extent of the condition is and how to really fix the underlying problem. But tip number 1 would be posture control. With this type of injury, you've damaged a lot of the muscles and joints and tendons and ligament structures, and so it's important to have a good posture and a good balance of your head on your shoulders. And the way you can do that is by taking your chin and pushing your chin back and then gently releasing off of that. That is a position that is more balanced. Your head is more balanced on your shoulders, and it will create less strain and hopefully less pain. Tip number 2, very important to maintain good flexibility after an injury, because often what happens is the connective tissue and the joints in your body, they tend to really get tight and get locked up and contract. And if you heal in a very contracted way, you're not going to have that flexibility, and you're going to generate more scar tissue and more pain. So very important to take your neck through all the cardinal ranges of motion. So you want to bend it forward, bend it backward, to the sides, and look over your shoulders. And of course, you're going to do this very slowly, very mindfully, and get as much range of motion as you can. A little bit of pain's okay. A lot of pain, obviously, not okay. Very important to be seen at that point if you're in an excruciating amount of pain, for sure. Tip number 3 is strengthening your muscles, and we don't want to do this too early. It's important to get good chiropractic treatment, get mobility back in the spine, get some flexibility back in the joints, and reduce the pain before implementing the right type of strength protocol to really help you heal and regain what you lost. But once you get to that level, what you can do is go through those same cardinal directions, but this time add some pressure. So go ahead and push into your hand and initiate the type of contraction in your muscles. Go ahead and push into your hand this way and feel the contraction of the muscles. And try to do that in each one of the directions in order to engage a little bit more of a strengthening mechanism within the body. That will help to create stability and balance and help to heal and create good circulation and so forth for your injuries. Tip 4 is take periodic breaks throughout the day. Every 30 to 60 minutes is really important, and I would set a timer to remind yourself to get up, to do these stretches, and to release the position that you're in, because we often hold postural positions for far too long throughout the day that can really aggravate these type of whiplash injuries. Tip number 5 is about lifting and carrying things at work and at home. Bottom line is be smart. Do not re-injure yourself. Change the way you handle yourself in your job, in the house, and while performing these recreational activities, be mindful of your body movements. That way we don't basically re-injure the area that's already in pain. So those are really the tips that I want to give you today. Be smart, stay educated, work within your range of motion. Your body will tell you generally what is safe, and most importantly, stay on top of this and stay in control. Don't just let these injuries go because they can stay with you for a very long time. So I realize you have a choice in whom you consider for your health care provisions, and I sincerely appreciate your trust in choosing my services for those needs. If you, a friend or family member, require care for whiplash, I would be honored to render my services. So please feel free to give my clinic a call, 360-925-6702, 360-925-6702, or visit me on my website at smokeypointchiropractic.com. And also check out my blog. It's drjasonhantzblog.com, drjasonhantzblog.com. And I look forward to sharing future videos with you and giving you some good information on how to take care of yourself and heal from various aches and pains that we get throughout the day. So thank you very much. Have a great day, and I'll talk with you soon. Bye-bye.